influence effects of indications of IV type solutions. Also, the tonic arrangements are IV liquids that have compartable centralized of broke down particles as blood. An illustration of an isotonic IV arrangement is zero point 0.9 is the normal and the saline is 0.9%. Since the convergence of the IV liquids is like the blood, the liquid stays in the intravascular space and assimilation does not cause smooth motion between compartments. So, the presentation of the isotonic IV arrangement organization with no osmotic development of liquid with the cells with the isotonic arrangement are utilized for patients with a liquid volume deficiency. So, additionally, hypovolemia is to raise their circulatory strain. That mixture of a lot of isotonic liquid can cause over-the-top liquid volume. So, likewise, hypervolemia. So, first is hypotonic is the arrangement of a lower convergence of broke up solutes than the blood, and the illustration of hypotonic IV arrangement is 0.5% is the normal and also the saline is 0.5. At that point, hypotonic IV arrangements are mixed. It brings about a diminished convergence of broke up solutes in the blood when constructed with the intracellular space. This causes osmotic development of water with the intravascular compartment into the intracellular space. The hypotonic liquids are utilized to treat the cell's lack of hydration for an outline of the osmotic development of liquid into a cell when a hypotonic IV arrangement is regulated, causing lower convergence and the pink particles in the circulation system that constructed with the inside of the cell. The second is hypertonic solution. Hypertonic solution is the arrangement in a have a higher grouping of a broke up particles than the blood. An illustration of hypertonic IV arrangement in the normal is 3% and also the saline is 3%. That the point of hypertonic liquid cause an expanded convergence of broke down solutes in the intravascular space. So, constructed with the cells that causes osmotic development of a water. So the cells into intravascular space weaken that solutes in the blood um, is an outline of osmotic development of a liquid. So the cell when a cell is hypertonic, IV liquids is managed because of a higher convergence of solutes in the pink atoms in the circulatory system. So constructed with the cell. So while they're regulating hypertonic liquid, it is the fundamental for screen for indication of hypervolemia. And also the example of hypertonic is breathing troubles and raised pulse. And also hypertonics with the sodium are given patient with the sodium level be monitored also. So the types of blood products for blood transfusions and also a blood bonding for the most part of alloys and exchange of one individual's blood to someone else. So it's deal for individual to get blood that coordinates with their own blood's classification on less in crisis or in a common condition. But an individual might be given of another kind that their framework will acknowledge the various sorts of the blood binding and incorporate with red platelets, plasma, and platelets. So, people are sometimes given infusions of whole blood during the severe bleeding. So, the example of this is after an injury or pregnancy complications, but usually they are given only the blood component that they need. So, the different components of blood include red blood cells, platelets, plasma, white blood cells, and also um, the antibodies or immunoglobulins and clotting factors, which are sometimes separated from plasma. So not all components are produced from a particular unit of donated blood. So, for example, the immunoglobulins and clotting factors may be prepared from a plasma pool together. So, from many donors, white blood cells and platelets are obtained by apheresis depending on the situations. So, people may receive only the red blood cells, platelets, plasma, or psychopathic transfusions, and only selected blood components allow the treatment to be specific, reducing the risk of side effects and different components from a single unit of blood to treat several people. So sometimes blood products are treated with radiation to reduce the risk of transfuse the white blood cells attacking the recipient's disease. And the red blood cells also a most commonly transfused blood component of can restore the blood's oxygen, so carrying the capacity. So this component may be given to a bleeding or who has severe the anemia. Plasma, when the components of is the first phosphated certain coagulating factors of is the factor of structure strong clusters at the lower part of the fluid plasma. So the structure this way are the known as the encourage of a significant skull and the name of cuneiform frequently given to individual. So cryos is also source of the patients who cannot produce the necessary amount of this important clotting protein on their own. So the granulocytes thus not necessary. Lastly, that necessary mean your white cells can be used to help patients in a need. So the granulites are a type of white cell that protects against infection by surrounding and destroying invading bacteria and the viruses. They can be used to treat infections that don't respond to antibiotics. So they collect also by an automated process called apheresis and must be transfused into the patients within into 24 hours. So being donated that since
That's
must
all.
be
Thank you.
used within 24 hours